Ever wondered why maintaining your liver health is so crucial? This unsung hero of our bodies is a powerhouse of functionality and plays a pivotal role in our overall health. One severe disease that can affect this essential organ is liver cirrhosis, a condition not to be taken lightly. It's crucial that we familiarize ourselves with the signs and symptoms of this potentially life-altering disease. So let's embark on this journey of knowledge together. Stay tuned to learn more about the signs of liver cirrhosis. Liver cirrhosis sounds daunting, doesn't it? But let's break it down. Cirrhosis is a late stage of scarring, fibrosis, of the liver caused by many forms of liver diseases and conditions, such as hepatitis and chronic alcoholism. But how does it develop? Well, your liver is a bit of a superhero. It's the only organ in your body that can regenerate itself, but its healing process is a double-edged sword. When the liver tries to repair itself, it forms scar tissue. Over time, the scar tissue replaces healthy liver tissue, limiting the liver's ability to function. Imagine trying to drive your car with the parking brake on. It might move, but not efficiently. That's what your body is like with cirrhosis. Your liver is on overdrive, trying to perform its regular duties, but it's bogged down by all the scar tissue. The liver is a bit like a city's waste management system. It processes nutrients from food, makes bile, removes toxins from your body, and builds proteins. So you can imagine if the waste management system of a city were to break down, the city would be in a lot of trouble. In the same way, when your liver can't effectively do its job, the rest of your body suffers. Long-term cirrhosis can lead to a number of complications, including liver cancer. In the early stages of the disease, you might have no symptoms. As cirrhosis progresses, symptoms can develop that indicate your liver is severely damaged. These might include fatigue, easy bruising, yellow discoloration in the skin and eyes, jaundice, fluid accumulation in your abdomen, ascites, loss of appetite, and leg swelling. It's a serious condition that requires medical intervention. Remember, your liver is a vital organ that you can't live without. It's crucial to take care of it. Identifying the signs of liver cirrhosis early can make all the difference. So, what should you look out for? When it comes to liver cirrhosis, there are several signs that should ring alarm bells. Today, we'll delve into the first set of these signs: jaundice, fatigue, and loss of appetite. Firstly, let's talk about jaundice. You may have heard of this term before, or perhaps you're familiar with its more common description: the yellowing of the skin and eyes. Jaundice is not a disease itself, but rather a sign of an underlying condition, in this case, liver cirrhosis. The liver's role is to filter out toxins from our blood, one of which is a substance called bilirubin. When the liver is damaged, as in the case of cirrhosis, it can't effectively remove this bilirubin. Consequently, the substance builds up in the body and lends a yellow tint to the skin and eyes. Next on our list is fatigue. This isn't your typical tiredness after a long day. It's a kind of exhaustion that doesn't improve with rest, and can significantly affect your quality of life. This occurs because a cirrhotic liver struggles to perform its many functions, including producing energy-boosting substances. As a result, you may feel persistently tired or weak. Last, but certainly not least, is loss of appetite. Now, this isn't just skipping a meal here and there. It's a consistent lack of desire to eat, which can lead to weight loss. This happens because cirrhosis impairs the liver's ability to help digest food and absorb nutrients, making eating less appealing to those affected. Now, these are just a few of the early signs of liver cirrhosis. Each of these symptoms on its own may not necessarily point to cirrhosis, but if you're experiencing more than one of these signs, or they are persistent, it's essential to seek medical advice. But wait, there's more to it. Continuing on from where we left off, let's examine the next set of symptoms of liver cirrhosis that should not be taken lightly. Firstly, easy bruising or bleeding. When the liver is damaged, it can no longer produce enough proteins that help the blood to clot. This can lead to a situation where minor bumps or cuts result in excessive bleeding or bruising. If you notice that you're bleeding or bruising more easily than usual, it could be a sign that your liver isn't functioning as it should be. Next, let's talk about swollen legs. Liver cirrhosis can cause fluid to build up in the legs, leading to uncomfortable swelling. This condition is called edema. The liver is responsible for producing a protein called albumin, which helps to retain fluid within the bloodstream. But when the liver is damaged, it may not produce enough albumin, leading to fluid leakage into surrounding tissues, hence the swelling. Lastly, unexplained weight loss is another symptom of liver cirrhosis. The liver plays a pivotal role in digestion and the distribution of nutrients in the body. When it's not functioning properly, it can lead to a loss of appetite and malabsorption of nutrients, both of which can result in weight loss. If you're losing weight without trying, especially if you're experiencing other symptoms we've discussed, it could be a sign of liver disease. These symptoms, easy bruising or bleeding, swollen legs, and unexplained weight loss, are signs that your liver may be struggling. It's important to remember that these symptoms could also indicate other health conditions, and that's why it's crucial to seek medical advice if you're experiencing any of these signs. To recap, liver cirrhosis can present itself in many ways, some of which may seem relatively harmless or easy to ignore. But remember, your liver is a vital organ that plays a key role in various bodily functions. Ignoring these signs could lead to severe consequences, so if you notice any of these symptoms, please seek medical attention promptly. These are some signs you should never ignore. Now that you know the signs, what's next? Early detection of liver cirrhosis is a game changer. It's like spotting a storm on the horizon, giving you time to prepare and secure your home. Similarly, recognizing the signs of liver cirrhosis early allows you to take action, seek medical help, and potentially slow or even halt the progression of the disease. A vital part of this journey is adopting lifestyle changes. Picture this: you're steering a ship, and the course you set determines your destination. The same applies to your health. The lifestyle choices you make today will shape your health tomorrow. So, what are some of these choices? Let's start with diet. A balanced, nutritious diet is essential. Think of it as the fuel for your ship. It keeps your body, including your liver, functioning at its best. Try to incorporate plenty of fruits, vegetables, lean proteins, and whole grains into your meals. And remember, moderation is key. Next, we have alcohol. Excessive alcohol consumption is a leading cause of liver cirrhosis, so it's important to either avoid alcohol or consume it in moderation. Just like a storm, too much alcohol can wreak havoc on your liver. Exercise is another crucial element. Regular physical activity helps maintain a healthy weight, which in turn reduces the risk of liver disease. It's like keeping your ship in top shape, ready to weather any storm. Finally, avoid harmful substances. These include illicit drugs and certain medications that can damage the liver. It's like steering clear of rocky waters that could damage your ship. Always consult with a healthcare professional before starting any new medication. In terms of treatment, it's usually about managing the symptoms and complications of liver cirrhosis. This may involve medications, lifestyle changes, or in severe cases, a liver transplant. It's a team effort, involving you and your healthcare provider, working together to navigate the course of your liver health. Remember, your health is in your hands. Like the captain of a ship, you have the power to steer your health in the right direction, so take charge, make wise choices, and keep your liver healthy. So, that's a wrap on liver cirrhosis and its signs. It's vital to remember that the liver is a resilient organ, but it's not invincible. It's in our hands to ensure its health and longevity by leading a balanced lifestyle and keeping an eye out for the telltale signs of liver cirrhosis that we've discussed today. We started by understanding what liver cirrhosis is, a late stage of scarring, fibrosis, of the liver caused by many forms of liver diseases and conditions, such as hepatitis and chronic alcoholism. We then delved into the two parts of the discussion where we highlighted the various symptoms, both subtle and apparent, that could indicate the onset of this condition. Remember, early signs such as fatigue, easy bruising or bleeding, loss of appetite, and nausea are often overlooked. It's essential to recognize these and seek medical advice promptly. We also emphasize the importance of prevention and treatment. This includes reducing alcohol intake, maintaining a healthy weight, and protecting against hepatitis. Treatment options range from medication and lifestyle changes to more advanced procedures like liver transplant in severe cases. The key takeaway is that liver health is integral to our overall well-being. It's crucial to be proactive in recognizing the signs of liver cirrhosis and taking action to prevent and treat it. If you found this video helpful and want to continue learning about health-related topics, please consider subscribing to our channel for more insightful content. Your health matters to us.